April. The nurse is made aware of the following client situations that require assessment. Which client does the nurse assess first? So the choices are the client who received packed red blood cells 4 hours ago and reports pruritus, the client 15 hours post total abdominal hysterectomy with hypoactive bowel sounds, the client with multiple sclerosis, slurred speech, and a current episode of incontinence, and the client post tonsillectomy reporting a sore throat and an elevated temperature. So help us unpack who the nurse needs to assess first.
So A, I'm going to say is a potential.
Okay.
Bad reaction. I don't know. The client 15 hours post. That could be a potential as well. I don't know.
So let's stay with B for a minute. They've had a total abdominal hysterectomy, so a TAAH BSO, which means what?
Uterus, ovaries, all that is common.
Right. So 15 hours ago, a surgeon was inside this woman rearranging her insides to get out what they needed.
So yeah, they worried she doesn't have bowel sounds.
Her bowel sounds are, the fact that they're hypoactive is perfect. We'd love for her to be past inflatus already, but hypoactive is pretty okay. Then the client with MS, slurred speech, and incontinence.
Is that expected?
Decrease, is that slurred speech?
So what do you know about multiple sclerosis?
You lose function sometimes.
So is there anything here that's abnormal for that?
No.
All right. The client after a tonsillectomy with a sore throat and an elevated temperature.
The elevated temp.
Yeah. Sore throat's okay.
Sore throat's totally normal, and it doesn't say how much the temperature is elevated. So if that were actually important in this scenario, it would probably give you the actual value. So the fact that they just have an elevated temperature, most people post-operative have some sort of a little temperature elevation. There's inflammation going on, they need to deep breathe because they were sedated, all that kind of jazz. So we're actually kind of not really worried about that one. And so that by going through each one of those, it brings you back to be able to reinforce your A answer, which was that the person who got packed red blood cells 4 hours ago is itching. Okay. So not all transfusion reactions are immediate, not all reactions to anything is immediate. It can be delayed by hours or days even. So that's the person who's going to need help the soonest.